Premier. Speaker, Ontario medical students are here today to lobby MPPs about mental health, and one of their top priorities is to reduce wait times for services. I commend these students for their advocacy, and I listened to the Premier as she talked to them this morning. I was struck by the contradiction between what she said to the students and what is happening in London, where her government is refusing to approve an innovative partnership between the hospital, the EMS, and the Mental Health and Addictions Crisis Centre to get non-acute patients much quicker access to service while reducing ER wait times. If the Premier is serious about reducing mental health wait times, why is she not finding a way to allow our London pilot project to proceed so we can start helping people now?
Thank you.
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker. So it is accurate that since last fall, the Middlesex London Emergency Medical Services approached and sought support from the Ministry of Health for review and decision on this suggestion for a pilot program for a diversion protocol. Because the crisis centre is not a designated hospital, that would have solved the problem had they decided to come under the auspices of London Health Sciences Centre. But in fact, in March of this year, after extensive discussions, including with my ministry and the LIN and the proponents and the Crisis Centre themselves, the Crisis Centre opted not to pursue that site designation. So as a result, we're left, Mr. Speaker, with a situation where there are two acts, the Ambulance Act and the Health Insurance Act. The Ambulance Act looks at patient care standards. The Health Insurance Act looks at what is an insured service, and I'm happy in the supplementary to go into the challenges there, Mr. Speaker.
Supplementary.
Thank you, Speaker. 2 weeks ago, my constituent, Angela Cameron Jolly, was forced to wait 7 days on a hallway stretcher in the mental health ER. This weekend, Londoners were appalled to learn the details of Angela's experience in the pages of the London Free Press. They were ashamed of a broken system that treats mental health patients so callously. I received an email that sums up how Londoners are feeling, and it reads, "I am horrified that this is our reality. To the elected officials, we owe our friends, neighbours and family better than this. We owe Angela and all the others so much more. A solution seems possible in having ambulance able to transfer to the crisis centre. It is worth trying on a temporary basis. Let's get this done." Does the Premier agree that Angela deserves an apology, and will she approve the pilot project now?
Thank you. Minister.
So, Mr. Speaker, I want to begin by acknowledging our medical students who are here with us today, and particularly their focus on mental health. I think that with the investments the province is making, but they know better than anyone just how important this is to their practice, but also to their patients, the clients that they're trying to support. We're working hard with all of the proponents. I would suggest to the member opposite that she join that process and work with me. Instead, if she wants to continue to raise this is the fourth time in the legislature, I actually, and I think most colleagues around this legislature knows, I actually work hard with my colleagues to find solutions. I'm confident that we will find a solution in this case, but it is challenging because there are two acts. I'm not prepared to break the law, but at the same time, and there's a meeting actually taking place this week between the ministry and all of the partners involved. I'm confident, together with the support from the minister beside me, the member from...
Sorry, time's up.